From KGW News, this is Straight Talk with Laural Porter.
Hello and welcome to Straight Talk. I'm Laural Porter. A recent DHM research poll shows that homelessness is still the #1 concern for people in the Portland metro area. And for the first time, the poll shows voters also list drug use as a top issue. In this episode of Straight Talk, we take a closer look at those often connected issues, homelessness and substance abuse disorders. How bad is it? How did we get here? And what are some solutions? We are joined by two experts on the topic from Central City Concern, the area's largest social services nonprofit serving the homeless population. Before I introduce my guests, here's a little bit about Central City Concern. It is celebrating 45 years serving Portland, employs 1,200 people, operates 2,600 affordable housing units with more to come, and runs 29 different programs in more than a dozen facilities. Services include primary medical care, mental health services, and addiction treatment, as well as employment services, job training, and post-incarceration life skills. We are joined by Dr. Andy Mendenhall, the president and CEO of Central City Concern. Dr. Andy is a physician, board certified in addiction medicine and family medicine. Also joining us, Sarah Holland. Sarah is CCC's Senior Director of Supportive Housing and Employment Services. Welcome to Straight Talk. Thanks so much for being here.
Thank you, Laural.
Thank you for having us.
Well, let's start off with, you have firsthand experience, hands-on experience with people who are homeless, addiction disorders. How bad is it out there? Paint a picture for us. We'll start with Dr. Andy.
Well, it's really tough out there, Laural, for folks that don't have the benefit of having shelter or housing as an option. And we know that the primary driver for that is truly a lack of those resources. We need more shelter, we need more housing and affordable housing. And in January of 2024, there were unfortunately in Multnomah County 5,400 people that were unsheltered or sleeping in vehicles, and close to 11,500 people that were listed as homeless.
And Sarah, what are you seeing?
I think the acuity that we're seeing right now is quite striking. You know, individuals have unmet medical needs, unmet mental health needs. They're pretty active in their use disorders. And so, you know, there's a lot of suffering that they're experiencing and challenges as they're trying to navigate not only how they're surviving every day, but how are they going to change their situation?
Well, so what we know, what we're dealing with here, fentanyl is something a lot of people have heard about, and the trouble with fentanyl. How addictive is it? How powerful is it? And how does it work on the brain, Dr. Andy?
So fentanyl is an opioid, and opioids include things like heroin or opioid pain pills, hydrocodone, oxycodone, OxyContin. Fentanyl is an opioid. It's 50 to 100 times by weight more potent than just about any other type of opioid. We use morphine as a reference, and unfortunately a more potent opioid means that it leaves a deeper reward imprint on the brain, which means that it's more addictive. And people develop both a stronger physical dependency, but then they also develop a stronger desire to continue to return to use, which makes being abstinent from fentanyl much more difficult.
And what have you witnessed, Sarah?
The increase in overdoses has been overwhelming, really. You know, we, in a very short period of time, significantly expanded the amount of naloxone that we carry throughout our facilities, as well as trained hundreds of staff to actually respond, because we were seeing it not only in our programs, but all around the buildings that we operate in Old Town.
Well, let's talk about how we got here. What are your thoughts on that? We've heard from the city and the county for years. They have grappled with ways to address homelessness and addiction, and they certainly have a lot of money. Taxpayers have approved boatloads of money, but yet when people look around, they don't really feel like they see things getting better. What are we doing wrong, Dr. Andy? Where have we gone wrong?
So there's two primary areas where we have had inadequate strategies. We've had an inadequate strategy of building enough shelter just to get folks into a place that's warm, that's dry, and that's sanitary. And in parallel, we have, for a couple of decades, not built enough housing. We literally don't have enough housing supply. And as a result, rent costs have gone up, which drives an increased risk of folks becoming houselessness. I'll pass to Sarah as well with respect to behavioral health and substance use disorder treatment.
Yeah, I think the comorbidity that we're seeing, where folks are struggling to navigate the symptoms and then the acuity of the dependence that they're feeling right now, and just not being able to navigate in real time when they're ready to take the steps to address their addiction, to address their mental health needs, that there's a place that they can go to immediately. And so that's a real challenge within the system that makes it problematic for folks to actually start recovery.
And the Oregon State Hospital has a lack of enough beds, right?
Mm-hmm.
Exactly. So two parts on that one. I mean, the first is that we've been underbuilt at literally every part of our system of behavioral health care in our region and in our state for more than 2 decades. We haven't had enough inpatient psychiatric beds. Mm-hmm. Substance use disorder treatment beds. We haven't had enough workforce and meaningful workforce development, especially for folks working in public health and working to take care of those that are less fortunate. It's much more lucrative to go and work in private practice. Across every aspect of the behavioral health system of care, we've been underinvested, and that's also playing out with respect to the Oregon State Hospital and lack of access for folks who are civilly committed or need civil commitment to be able to receive services there and then be restored to their freedom to re-enter in a stable fashion back into the community.
And Dr. Andy, you have been laser focused on something called population health data. You've been gathering that with your key health system partners to learn more about people experiencing homelessness, how it's affecting their health care. First of all, tell us, what is population health data and why is it important?
So population health data, Laural, is typically information that we gather from data that's collected within health systems and health insurance companies that tells us how are people utilizing the healthcare system. And in our region, we have some wonderful leaders in the Medicaid space. And those leaders are folks at HealthShare of Oregon and Care Oregon. It's important to remember that we have 1/3 of the Medicaid population in the metro Tri-Counties area. 1/3 of the state's Medicaid population. It's close to 460,000 people. One other real key partner in this area is Trillium Community Health Plans as well. So about a year and a half ago, folks from Care Oregon, HealthShare, Central City Concern, and the Providence Centers for Outcomes Research and Education got together, and we said we want to understand how big are the populations of people that have a couple of core problems that are driving high acuity behavioral health and maybe associated with homelessness. And those conditions were psychosis, meaning really severe mental illness, oftentimes associated with schizophrenia, opioid use disorder, think fentanyl, and stimulant use disorder, think methamphetamines. And it was really important to ground in that data, and we'll talk a little bit more about that.
We do have a graphic that illustrates
Yes.
just how sick people are and how much they're using the healthcare system. Can you speak to this?
Absolutely. So what we learned is that among those 3 categories, there were about 30,000 people, at least who were beneficiaries of the Medicaid benefit through HealthShare. Represents about 10% of the adult population of HealthShare, and they're consuming close to 40% of all of the healthcare resources. So you have a small number of people consuming a ton of healthcare resources. The problem is all of that resource consumption is not driving outcomes. It's paying to treat the complications of untreated behavioral health conditions and untreated homelessness.
And how is that impacting the overall healthcare system?
It's a great question. It's really difficult because if folks are occupying beds in hospitals and are stuck there because they've got no place to go, that impacts other folks that might be served that either have elective or non-elective conditions. It creates compression across the whole system. Sometimes that means people have to wait a little bit longer in order to get a service that's necessary. More importantly, it just means that we know that there are gaps in the services that people need on the back end of hospitalization, and ideally, we would rather see all of those resources invested in the provision of services that actually drive improvement and drive outcome rather than just treat complications.
And do a lot of these people end up in the ER? Do they go to the ER for their primary care?
We've seen evidence that depending on the individual and their condition, folks are sometimes admitted to the hospital between 9 to 14 times more than individuals who don't have a high-risk behavioral health condition and are not and also don't have homelessness.
Let's talk about a hot button issue right now, Measure 110. That is the voter approved measure that legalize or decriminalize possession of small amounts of drugs. And the legislature recently passed a bill that's a compromise bill that changes how we handle drug use in the area. It makes it a newly classified misdemeanor that would require probation, treatment, and in some cases, if probation is violated, jail time. What are your thoughts about how this change and how we handle drug use in the area, how that's going to impact the people that you deal with? What are your thoughts, Sarah?
Absolutely. Addiction, use disorders, it's a complicated issue, and it's as unique as people are. And, it's going to take an intervention that allows for treatment, that allows for opportunities for individuals to really seek the medical care that they need. And it really is going to take collaboration across systems. It needs to be justice, politicians, community partners, the healthcare system, to really address in a holistic way the need that we're seeing within our community.
And Dr. Andy, I don't know if you listened to the podcast. The New York Times did a podcast, The Daily, and it focused on Measure 110 recently. And it reported some lawmakers and others felt that Measure 110 failed because it was poorly executed. And at the time that it was launched, we didn't have the treatment facilities and treatment beds available. And so that Oregon, being at the bottom of the barrel when it comes to access to treatment, really was the worst place to experiment with decriminalization. What are your thoughts about that? Do you agree with that?
So in general, I absolutely agree. I think Measure 110 was successful in driving resources that didn't previously exist into the community to develop more resources to treat folks with substance use disorder. That's the one area of success. But I absolutely agree with the premise that decriminalizing substance possession during a time and in a state that had one of the most underbuilt behavioral health and substance use disorder systems of care was certainly going to be a risk for what we then ended up experiencing within this region. Nobody could have necessarily foreseen the long-term impact of the pandemic and the long runway that this had in terms of reduction in access to treatment services between 2020, during the passage of this bill, and up until today. And I think, unfortunately, folks did not foresee the impact of fentanyl and new methamphetamine arriving to really, if you will, throw gasoline on the fire of a problem that it's going to continue to take time for us to resolve.
And this compromise bill is supposed to make treatment more available. What do we need to do differently?
So a couple things. First, we have to recognize that today in Oregon, there's still not enough behavioral health care services, substance use disorder treatment services for people who are seeking treatment. So we have to acknowledge that truth. We need to change that truth by rapidly expanding access to substance use disorder services at all levels of care. And in addition, we need to recognize that this compromise bill is seeking to provide a provision for deflection, right? An alternative to prosecution. And that alternative means being at least engaged in some type of assessment, some type of potential referral. And if we're going to be referring more people to treatment, we need to even more rapidly expand available treatment services in order for a deflection program to be successful.
Let's talk about another one of the ways that you're trying to respond. You've launched mobile health teams, a mobile health program, partnering with Medical Teams International, and you're going to temporary assisted shelter sites providing all kinds of care, primary care, dental care, behavioral health care. Sarah, how is that working? How are you being received?
Absolutely. We've really taken a strategic approach to move our front door and meet people where they're at in the community. And so being able to bring medical services, dental services, and prioritize the thing that's most important to the individual to treat first, it's allowing us to build relationships with individuals that aren't necessarily moving into systems where they can get the services they need. And so we've seen it already in a very short period of time have a significant impact on the quality of life that people are experiencing outside as we work to house them and bring them back inside.
Let's talk about that. How does housing, employment, how does that all intersect with what we're talking about in healthcare?
Yeah, absolutely. We believe that housing is healthcare. And without having someone housed, you can't actually fully meet their medical needs. And we can't help them treat their addiction. So really having the combination of housing with employment. And employment is an intervention that allows people to find purpose, that helps them provide structure to their day, as well as it allows them to create a life that they're going going to be able to maintain. And so we've seen within our own programs that when someone is able to get a job and has the support from an employment worker who can help them get through that whole process, which is not necessarily always easy to navigate, that they're 7 times more likely to maintain their housing year after year. And so it's a very successful element of having an intervention that allows someone to really change, what might have been living outside for 10, 15, even 20 years. We've seen it work.
Well, in talking to you before the show, I learned about something that I didn't know about. It's called the 1115 waiver, right? The Medicaid waiver. We're 2 years into this 5-year pilot program. Oregon's just one of a handful of states involved in this program. It aims to explore different ways to affect health outcomes for communities and groups disproportionately affected by health inequities in our state. Can you tell us how this waiver 1115 is helping at Central City Concern?
Absolutely. It's really focused on the social determinants of health and using healthcare dollars to support other needs. Housing's one of them, nutrition is another, and then also environmental support. So, for example, an air conditioner for a unit that doesn't have one. And what we've seen with the 1115 waiver is that having an influx of resource to help someone stabilize medically is a critical intervention that allows them to navigate what would otherwise be an unmet medical need. And so we're really trying to stop a cycle of houselessness and unmet medical need, and in a way that allows the system to be much more nimble than perhaps our historical housing waitlist structures.
Do you want to add to that, Dr. Andy?
Oh, it's so beautifully stated. I think it's really significant to recognize that in America, since the late 1970s, we've spent between 0.1 and 0.25% of the national gross domestic product on our federal housing and urban development program. And during the same time, spending by the Centers for Medicaid and Medicare Services, which cover about 50% of the nation's population, has grown to between 8 to 9%. In 2021, that's $1.345 trillion. It's a much, much larger bucket of tax dollars, and the ability to pull those tax dollars to provide access to housing and support of other social determinants and health-related social needs is really innovative. We're very excited about this program because it's a way of providing resources to folks that are housing insecure, potentially medically fragile, and it's always important to remember that for the last 3 years and running in the United States, folks over the age of 60, aging adults in our country have become the fastest growing group of individuals becoming houseless. So it's really important to acknowledge the significance that being able to pull down healthcare dollars to support funding for housing, funding for rent support, and other health-related social needs will have in changing the narrative for many vulnerable Americans.
Well, it sounds like Oregon's really lucky to be a part of this program.
We very much are.
Dr. Andy, Sarah, it's time for us to take a break. When we come back, we'll look at some of the exciting programs and projects that Central City Concern has in the works. We're back in 2 minutes. Welcome back to Straight Talk. I'm Laural Porter. We're talking with folks from Portland's nonprofit Central City Concern about some of the exciting and innovative things they're doing to help people who are homeless and those with addiction disorders. Welcome once again to my guests, Central City Concern's President and CEO, Dr. Andy Mendenhall, and Sarah Holland. Sarah is CCC's Senior Director of Supportive Housing and Employment Services. Thanks again for being here, and thanks for the service that you provide to the community. You know, one of the exciting programs you have, Sarah, is something called Clean Start. What is that? How is it helping folks?
Yeah, it's what we call a social enterprise program. And so what it is it's an actual employment program that takes individuals that maybe don't have a work history, or they might have a complicated background that would make them less appealing to an employer typically. And so what it does is it provides them the opportunity to receive on-site training, to receive support and supervision from somebody who also has lived experience, who has been where they've been and rebuilt their lives. So they can provide that coaching, that reinforcement, and they're out every day in Portland helping clean our community. So they're picking up trash, they're removing removing graffiti, and they're interfacing with the community in a way that's profoundly restorative for them. So every time someone looks at them and says thank you, it makes their day. And talking about how that momentum that they build within that program allows them to take the next step and be employed in another area of Central City or in the outside community and continue their journey of exiting houselessness.
That's got to make you feel good when you see that success.
Yeah, it is the most rewarding interactions that I think we have is when we're out with the Clean Start crew, just seeing them engage and feel so different about themselves and how they're contributing to, a community that they might have been feeling really disconnected from, and how that bond really reinforces all of the positive decisions that they're making in their life now.
Well, something else exciting that's happening is you have a new building that you're renovating and opening. It's a new treatment center. Tell us about that.
So we're really excited, Laural, about a new facility on the corner of 16th and Burnside, closely located to other core substance use disorder support services. This is going to be a 70-bed residential program for individuals with complex substance use disorder and co-occurring behavioral health conditions like depression, anxiety, other mental health conditions that require an extra level of expertise, as well as a little bit more time in a more secure environment for folks to have the opportunity to stabilize, get healthy, and be successful on their journey to recovery. This is one step. Folks will then step down into a housing intervention along with supportive outpatient treatment and just continue along that pathway. And this is part of the Central City Concern legacy of ensuring that we're providing folks access to the services they need to get well, get into recovery, and socially reintegrate, rehabilitate, and go on with their lives. We see success every day.
Well, this is something that we've heard the community talk about that we really need. When does it open, Dr. Andy?
We're planning to open this in the fall of this year, so we're hoping for a November go live, and then we'll be ramping the census over the course of the next 6 months. Very proud of our teams, very grateful for the partnership between leaders at the city, at the county, at the state, who have really made this project possible. We're also very excited to see a whole docket of different services coming out. I want to call out our excitement about the partnership between Chair Vega Peterson, Mayor Wheeler, and staff, and this week's release of the Homelessness Action Plan. We're very excited and know that this will make meaningful difference in the community.
Well, before we go, I do want to find out what you think really is going to take to make a difference. What is the timeline, in your opinion, for seeing a real difference?
I think for residents of this community, I think we all live in this community, we're starting to see some change, but there will be unequivocal, deep, meaningful change in terms of the feel, the sights, and the sense of safety and recovery of our community within the next 18 to 24 months. The outline in the Homelessness Action Plan is comprehensive. The key will be execution, and the key will be ensuring that there's community support for the location of the shelter and the housing resources, the other treatment resources that are going to be needed. That's going to be part of community partnership that we need to be successful.
I think you give people watching a lot of hope and encouragement that in 18 to 24 months that they could really see a difference. We have just a little bit of time left. I want to give you each time for a final thought that you'd like to leave with our viewers.
Yeah, I want to echo the hope. Every day Andy and I get to go to work and partner with staff who are showing up every day, helping people learn how to live inside, how to find a job, how to celebrate their first check, their first 30 days without substances. And, as big as the problems feel right now, the reality is people are rebuilding their lives too. And so I'm profoundly optimistic about our future and very grateful for the dedication of our staff that show up every day, as well as other partner agencies across the community that are doing this work and helping folks become housed.
Dr. Andy, about 30 seconds.
Well said, Sarah. We see people recover from the most severe substance use disorders, the most severe mental illness conditions, the combination of both. Folks that have lost hope. We see hope strength, experience, resiliency, and recovery happen every single day in our hallways, in our programs, in the communities that we operate. We see the same thing with our sister organizations all across the region, and we're just so excited to really see things turning. There's reason to believe in recovery. I believe in the recovery of our community. It's underway, and it will most definitely continue.
Well, it's refreshing to hear a hopeful sign about what's going on in our streets. I know people will really enjoy hearing that. If you'd like to find out more about Central City Concern and or donate, there's contact information on your screen right now. Sarah Holland, Dr. Andy Mendenhall, thank you so much for being here on Straight Talk.
Thank you, Laural.
And thank you for watching. Remember, you can get Straight Talk as a podcast. You can listen to us. Just go to wherever you get your podcasts and search for KGW Straight Talk. Thanks again. We'll see you next week for Straight Talk.